Let's talk about a central line versus a PICC line. Okay, the first one is a central line. So a classic central line is an accessible line which enters through a large vessel that goes to the heart, and it's usually seen in the neck or the chest area. Central lines are typically placed for long-term drug therapy. The memory trick here is central line brings medication, fluids, etc. to the center of the body, aka the large vessels near the heart. Okay, next is a PICC line, which is very similar to a central line, but it's inserted in a different place. So a PICC line is a type of central line. You can think peripherally inserted central catheter. It is inserted peripherally. The memory trick here is P stands for peripheral. These are typically inserted in the upper arm like seen in this picture. Again, they're a type of central line, they're just inserted peripherally. I feel like it's important to mention what a midline catheter is because a lot of students get this mixed up. So a midline catheter is like a mini PICC, but it stops before it gets to the heart like you can see in this picture. You can remember this by the memory trick. It stops midway, so midline, think midway. Just to make sure we understand the core differences between a PICC line and a midline, let's look at a chart. So a PICC line leads to central vessels and the heart region, where a midline stops near the axilla and does not lead to central vessels or the heart. Again, it stops midline. PICC lines tend to have a higher risk for infection, where midlines tend to have a lower risk of infection. Well, why? PICC lines can remain up to 6 weeks in the body, and the longer the time in the body, the higher risk for infection. Where midlines are typically placed in 5 to 28 days, and they're taken out after that. So again, less time equals a less risk for infection. That's all for PICC lines versus central lines. You can find more nursing school help like this in the Complete Nursing School Bundle. It's full of memory tricks like you've seen in this video. Happy studying, future nurses.